There are 4 types of hypersensitivity, and we'll start with type 1. Type 1 is also called immediate hypersensitivity, and it occurs, well, first there's an initial exposure to the antigen, which is the sensitization phase, in which you develop IgE antibodies against the antigen from the first exposure, and this occurs with especially in people with atopy. Atopy is a genetic component that makes you sensitive to these allergens, and you typically would have asthma and eczema and allergic rhinitis. And then when you're re-exposed to this antigen or allergen, this IgE is already formed, and when the antigen binds to the IgE that's on the mast cells and the basophils, it causes them to degranulate, meaning that they burst open and release their chemical mediators, especially histamine, and this causes cell injury and allergic symptoms. But in the worst case scenario, it can also cause anaphylaxis, which it produces severe bronchospasms, wheezing, urticaria or itching, skin flushing, and angioedema, which is a sudden swelling of the subcutaneous tissue, and it can also cause severe hypotension and edema, since all the fluid is going to the subcutaneous tissues, causing edema. There's low fluid in the blood, which causes hypotension, low blood pressure, and this can lead to anaphylactic shock, because not enough blood's getting to the tissues since there's low blood pressure, and this causes death. And to treat, you would need to remove the allergen, immediately administer epinephrine, and then also administer antihistamines. So type 1 involved IgE, but you'll see that type 2 and type 3 involved IgM or IgG. So type 2 hypersensitivity is also called antibody-mediated or cytotoxic hypersensitivity. You can remember that type 2 is also called cytotoxic hypersensitivity because you could just exaggerate the sounding of cytotoxic to cytotoxic, so type 2. And just know that even though it's called cytotoxic, it's just referring to that it kills cells. It does not involve cytotoxic T cells. Type 4 involves cytotoxic T cells, but no T cells are involved in type 2 or any of the other ones besides type 4. So this occurs when IgM or IgG bind to a cell-bound antigen, and this causes cell lysis via complement-activated membrane attack complex, MAC, which forms pores in the cell and the cell lyses, or by natural killer perforance by a similar mechanism. And so the cell dies, which is cytotoxic. The cell dies. And typically the cell-bound antigen is on blood cells. So type 2 reactions usually cause hemolysis. Cell lysis of blood cells is hemolysis, which cause anemia or decreased red blood cells, thrombocytopenia or decreased platelets, and leukopenia, low white blood cells or leukocytes. And examples of blood-related diseases are blood transfusion reactions and hemolytic anemia related to Rh isoimmunization. And then these cell-bound antigens can also be on other organs or cells, but they're usually on blood cells. But one example of a non-blood cell-bound antigen is a Graves' disease, which occurs on the thyroid. So This was type 2 involved cell-bound antigens, whereas type 3 will have free antigen antibody complexes. Free. So type 3 hypersensitivity is also called immune complex mediated reaction, and it occurs when antigen antibody complexes, antibodies involving IgM or IgG complexes form, and this causes complement activation and an inflammatory response from the polymorphial nuclear leukocytes, which are also known as granulocytes. Those include these in the orange: the neutrophils, eosinophils, basophils, and mast cells. So this causes tissue damage. And even though these antigen antibody complexes are free, they can be deposited on blood vessels or on organs or other tissues. So when these complexes deposit on blood vessels, it causes an inflammation of the blood vessels, which is vasculitis. And this can occur on kidney glomeruli, which in lupus, this can lead to decreased kidney function, and which has a risk of kidney failure. And then they can also be deposited on small blood vessels of the skin, which explains some symptoms in lupus, such as the butterfly rash that is on the face but spares the nasolabial folds, or discoid lupus, which are disc-like rashes, or arthritis reaction, which is localized tissue necrosis. But this reaction can also be caused by rheumatoid arthritis and two drugs, anti-lymphocyte globulin and streptokinase. And then if it's deposited on the synovial lining of the joints, it can cause arthritis, which is also a symptom of lupus. And another type is serum sickness, which can be caused by if somebody gets a snake bite and they're given anti-venom antibodies and they develop a type 3 reaction. It can cause local itching and rash at the site, or it can be systemic and cause edema, and fever. Then this is the type 4 reactions, which do not involve antibodies, but they involve T cells. So it's called T lymphocyte mediated hypersensitivity reaction. So there are two types. One is direct cell mediated toxicity, and this involves the cytotoxic CD8 positive T lymphocytes. And these cytotoxic T lymphocytes attack all infected cells with recognized antigens, even if they're not harmful. And this causes graft versus host disease, in which the donor T cells attack the host cells, and this produces rash, diarrhea, and liver disease. And then the other type is delayed hypersensitivity reaction, which is mediated usually by T helper type 1 cells. And there's a sensitization phase and a elicitation phase. The sensitization phase forms memory cells in the dermis against a specific small antigen that can penetrate the skin. And the elicitation phase is when memory T lymphocytes release cytokines and chemokines. Examples of this are contact dermatitis caused by poison ivy, and then a positive TB test